right, so we want to welcome everyone to Screen Time with today's Communiqué. So excited to have two powerhouses in the community with us today. We have Ms. Sandra Brown, who is the director of the Jefferson Comprehensive Care Health Clinic, as well as Dr. Emmanuel Kelly, who's the medical director there. And of course, we know that December is HIV and AIDS Awareness Month, and that is our focus of our conversation today. And so welcome, Dr. Kelley, and welcome, Ms. Brown. So before we jump into our conversation, I want all of our viewers to learn just a little bit about you guys. So Ms. Brown, tell us a little bit about your background and how you came to Jefferson Comprehensive.
Thank you first for inviting us to be here with you on behalf of Jefferson Comp Care. My background has been public health. I have worked for Baptist Health and community health as well as teaching. And then professionally, I have academic degrees in community health nursing and a master's in public health from Tulane. After leaving Baptist, an opportunity presented itself at Jefferson Comp Care. And I had no idea that one day I would be the CEO, but I love public health. And if anyone knows me, pretty much that's what I've done all my professional career is advocate for the public.
Absolutely. Everybody knows you and everybody knows all of the work that you've been doing over the years in the community. And so thank you for what you've done and what you continue to do in the community. And so Dr. Kelley, tell us a little bit about you and your background and how you got over to Jefferson Comprehensive.
Well, I'm Dr. Emmanuel Kelly. I grew up in Phillips County, Marble, Arkansas. Attended college at University of Arkansas at Pine Bluff. Did some graduate work at University of Arkansas in Fayetteville. I attended medical school at the University of Colorado in Denver, Colorado. I completed residency at UAMS in Little. But my first position out of medical school was at the Big County Public Clinic in Marion, Arkansas, and that's where I started my work in the community health center. I was in private practice for about 5 years, and before completing the residency and returning. So my heart has been in community health. So I've been in for a total of about 35 years in the community health centers.
All right, yes.
And I've been involved in HIV work for the past about 15 years, but more in the last 5 years.
Okay, great. So you guys are truly experts in what you do, and we are so glad that you are taking some time out of your schedule just to help us to learn just a little bit more about HIV and AIDS. And so let's start right there. I'll turn it over to you, Dr. Kelley, first. How would you define HIV and how would you define AIDS? What's the difference?
Well, HIV stands for human immunodeficient virus. And basically, a person with HIV basically gotten infected with the immunodeficiency virus. Okay. And the word AIDS stands for acquired immune deficiency syndrome, which is an advanced stage of HIV.
Okay. And so, how does one go about contracting? How do you get HIV?
Well, HIV is a sexually transmitted disease. One, and for the majority of patients, probably get it that way. But you can get HIV several ways. One, you can get it by sexually contact with someone with the virus. You can get it by intravenous drugs. You can also get it from the mother to the child, and but it's never around. You can get it that way, and also you can also get it from the breast milk mother. That's every rare, but the most common way of getting it is through sexual contact. And secondly is those that really high risk, for example, men who are having sex with men.
All right. So we've learned what HIV is, we've learned what AIDS is and how we get it. Let's talk next about how prevalent HIV is in the state of Arkansas and particularly in communities of color. And so, Ms. Brown, do you talk a little bit about how prevalent HIV is in the state and in communities of color?
Thank you. I'm not sure, Kenya, if you saw the recent report, but by this time last year, ACI did a report on HIV in Arkansas. And at that time, the data was 2017, but the report is December 2019. There are over 6,000 individuals with HIV AIDS in the state of Arkansas. And when that study was completed, 53% of the new cases was in the Black community, with Blacks. And 37% were white and 8% is Hispanic. But as we know, HIV is high in the minorities communities, especially Blacks, and not just Arkansas, but around the country. And as you know, you'll be seeing information on ending the HIV epidemic. And Arkansas is one of those states that, in some states they did by counties, but our state, because of the size and the prevalence, the whole state is being affected. So indeed, it's a problem. And it's really a problem in the minority community because we, a lot of times, don't always deal with how it's transmitted, and we don't always be honest. And then it's a stigma. Then too, we are a religious conservative group of individuals in the minority community. So we get into not wanting to talk about it because the way we view religion and church and our values when it comes to that.
Absolutely. And thank you for bringing those points up. We're going to definitely talk about the stigmas and how we can help reduce the rates of HIV and AIDS in the community, and particularly in communities of color. So thank you for bringing those up. And so what I wanted to do next is to kind of shift gears and talk a little bit about some of the myths that are out there surrounding HIV and AIDS. And we can just kind of piggyback with each other. Ms. Brown and Dr. Kelley, there are lots of myths out there surrounding how one gets HIV, who gets HIV, and things like that. So let's talk about some of the myths and just try to debunk those, and then also state the facts. And so one of the first myths that's out there is that HIV is a death sentence. And so one of you like to address that particular myth?
Well, no, HIV is not a death sentence. Initially, when the disease first became known, it was considered a death sentence. But now, with the medications that are now available for treatment of HIV, persons with HIV can live and live a normal life. The life expectancy to a person with HIV is very few years shorter than a normal person's lifespan. As long as they adhere to the medication and treatment, and along with maintaining the health and lifestyle.
And so another myth that's out there that I've heard of is that only certain people get HIV. Is that true? And if not, let's correct that myth.
No, that is not true. Initially, like Dr. Kelley said that, and I thought about it when I was in graduate school getting my master's in nursing, I was charged with teaching an accelerated group of students, and that's in the 80s. And I had to go to the library to research. They wanted me to do on HIV because that was a hot topic. And then that's when I began to learn, because like everyone else, we thought it was a gay disease. Let's be real. Right. But it's not. Anyone could get HIV, and especially sexually active people. And Dr. Kelley probably would tell you that everyone from 15 to 65, they say you should get an HIV test. And then the question asks you, will you be retested? Yes, if you are sexually active and you're not doing any protection, you should get tested often. So anyone can get HIV because the most common way of transmission is by body fluids, and the body fluids is sexual, and of course, also,
And so
a type.
yeah, you mentioned anybody between the ages of 15 and 65. I mean, when you think of people, 60 and older, those are people like, your grandmother, your great grandmother, your great grandfather, and people in that age. And so, so you're saying that people who are above the age of 60, if they're still sexually active, then they too should be getting tested for HIV. Is that correct?
Yes. I think you probably, maybe a couple of years ago, they did a show that in Florida, in a retirement community, there was a high incidence of HIV.
So anyone who's sexually active, we want to drive that point home. Anyone who's sexually active needs to be tested for HIV, no matter your age. And so another myth that I want us to debunk or clarify or state the facts on is that HIV positive people can't safely have children. Is that true, or is that not true? Or do we need to clarify that?
Well, what HIV patients can have children, but if they're going to have children, they should be on medication that the viral load is suppressed or undetectable. Mm-hmm. And that decreases the chance of transmission of the virus to the child. So make sure that their virus is suppressed and take the medication during the entire time of the pregnancy. Mm-hmm. And if they do that, the chance of transmitting the virus to the child is pretty much nil.
Okay. All right. That's good information to know. There's another myth that's out there that I want us to discuss. HIV always leads to AIDS.
No.
True?
No,
okay.
no, that's not true. HIV is not always lead to AIDS. Man, when we say AIDS, as I said before, it stands for acquired immune deficiency syndrome. And so it's an advanced stage of HIV. And it's best defined as someone with we call it a CD4 cell count less than 200. Or if they got so-called opportunistic infections, that is infections that people don't usually get, something like yeast infection in the throat, certain kinds of cancers like sarcoma, or certain kinds of pneumonia like pneumocystis pneumonia. Mm-hmm. So those are kind of the AIDS defined in optimistic infections that patients can get. So it's defined as the cell count or if they get certain kind of infections.
Okay.
You take your medicine to do right, you never get full-blown AIDS.
Okay, yes.
I was saying, if you're HIV positive and you do what you're supposed to do, follow that plan, you can avoid getting full-blown AIDS. But a lot of times people get off meds, they get the systems get weakened, and then they go into full-blown AIDS.
Yeah.
So if they follow the doctor's recommendations as far as taking medication and keeping the viral load undetectable or suppressed, and CDK4 counts at a decent level, they won't progress into AIDS. Mm-hmm.
And I'm glad that you guys are pointing out those distinctions, because I think sometimes a lot of people equate, if you have HIV, you have AIDS, like they're one and the same. And so I'm glad that you guys are making that distinction, because they are not the same thing. So thank you for clarifying that for sure.